So you've noticed a vaginal bulge. When you're having a bowel movement, you have to place a finger in the vagina to empty your bowels. You have to strain excessively to have a bowel movement, to lean forward or lean back to empty your bowels. You may feel like after you've gone, you haven't quite completely finished, or you get an urge and you have to really, really race there when you feeling that you may not even make it there at times. You may have some pressure in the vagina. All of these things could indicate you have a rectocele and you don't and not even know it. Dr. Stephen Tugbiyele, board certified fellowship trained urogynecologist, and I've cared for thousands of women with pelvic organ prolapse or a bulge in the vagina, particularly a rectocele, that has really impacted a woman's quality of life. And if you're a woman listening to me right now, know that you don't have to live or put up with it. These things are common. You didn't cause this. It's caused by so many different things, whether it's having children, menopause, constipation can cause it. But there are safe and effective solutions nowadays, I tell my patients. And so you don't have to live or put up with it. There are good and effective solutions nowadays to take care of this condition called a rectocele. The previous video where I talked about rectoceles, what they are and how they came about and why they happen. If you haven't, you want to definitely check out that video. In this video, we're going to talk about exactly how to fix it surgically. Now, granted, nobody wakes up in the morning and says, "Oh, I want to have surgery and I want to go see a urogynecologist." No one does that, right? And there are options. Now, yes, can physical therapy be an option or pelvic floor exercises? For women who've done that, some women may find, yes, it's been helpful, but other women may find that they still have the bulge, that even after physical therapy, the bulge hasn't gone away. All of their symptoms haven't quite gone away. A pessary is another option. We talked about pessaries before. It's a ring-like device that goes in the vagina, made of silicone. It's fitted, bulge and the pressure, and so that women can have a normal bowel movement. But it just so happens that some women, the pessary may not be ideal for them. They may not want a device that they have to clean, take in, and take out. And so there are options beyond physical therapy or a pessary. And that's where surgery comes into play. Now, again, no woman wakes up in the morning and says, "Oh, I want to go see a gynecologist. Oh, I want to have surgery." However, if it seems like surgery is the next best step, know that it is effective and it can help you gain your quality of life. And so I wanted to talk about what the surgery will entail. And so I'll pull up this picture first. And as you can see here, this is a side profile of a woman, right? This is in the front pubic bone here, tailbone here, vagina is in the middle here. This woman is sitting or standing, and the bladder is here, uterus is here, and this is the rectum. And this is a normal picture of a rectum where it's nice and flat. And these are the nice pelvic floor muscles that go from front to back. And as you can see in this picture, right, compared to this picture, is a normal rectum, and this is a rectum that's bulging into the vagina, again, called a rectocele. And with this bulge, stool can get trapped here. Rather than sliding out here, it can get trapped in this bulge or pocket. And my patients will say they feel like a pocket or it's like stuck there. And then you may feel like you have to strain before you can completely empty out this pocket, or you may feel you have to press here to empty out this pocket, and discomfort that's associated with the bulge down below. Not to mention, it also widens the vagina and makes things uncomfortable with intercourse. So a lot of things can happen with the rectocele, and that's what a rectocele looks like compared to this normal picture. When we talk about surgery, thankfully, there are good and safe, effective solutions to address this surgically, vaginally. That's minimally invasive, and this is how that surgery looks like. And so this is, again, let's see here. This is the uterus. This is the vagina here. And this is the rectocele, or that rectal pocket that's bulging into the vagina. And so what we do, as I tell my patients, you won't see, feel, or hear anything under anesthesia. What we then do is open up the vaginal skin, similar to a hernia repair. The actual issue is with the connective tissue underneath the surface of the vagina. So when we open up the vaginal skin, that reveals the connective tissue layer. This connective tissue layer is repaired and strengthened using suture material or stitches, right? Then that helps to support the connective tissue layer back to its normal shape. Then on the surface, the excess vaginal tissue is trimmed, and then that's now repaired with suture material, right? And so there are two layers. The underlying connective tissue is repaired using suture material, and then the overlying vaginal skin is repaired using suture material in a tension-free manner, tension-free fashion, so to speak, all using suture material. So it takes the pocket here, and that pocket is repaired using suture material, as you can see here. very successful procedure. It's a vaginal procedure. And in terms of recuperation, oftentimes the procedure itself takes under an hour done vaginally. So it's an outpatient procedure. And in my patients, I tell my patients in terms of recuperation, that day before going home, we take out the catheter and the packing that's typically placed in the vagina during the healing process. Right after surgery, that's removed and then women go home. And then in terms of recuperation, I usually say those milestones are 2 days, 2 weeks, 2 months. So the first 2 days when you get home, we want that swelling to go down. Oftentimes, have my patients use an ice pack on or off to help to reduce the swelling on the outside. It's typically comfortable during the healing process because I put a lot of numbing medicine on the outer area, so that helps it be more comfortable. Few women have to take narcotics beyond a day or two, and most women don't take even anything stronger than ibuprofen in terms of their healing. The first 2 days when you get home, walking and stairs are fine. Back to driving after the first 2 days. Once the swelling goes down and you can sit comfortably in a car for an extended period of time, then you can start driving. Showers are fine. However, you don't want the incisions to get immersed in water, both the ones on the outer area as well as on the inside. And so no tub bath, swimming, jacuzzi, hot tub. We don't want any of the incisions or sutures to get immersed in water, so just showers. After the first 2 or 3 days, typically women are comfortable, you start driving. And when you do have to go shopping or get groceries, I usually tell my patients in terms of lifting, not to lift more than 10 to 15 pounds. So a gallon of milk or a gallon of water is about 8 pounds. So lifting not more than would seem like a gallon in each arm. And then usually by 1 to 2 weeks, women feel great on the outside, but there's still a lot of healing going on the inside. And so it'll be not until 6 weeks before you're able to resume all your usual activities without restrictions. And so between 2 weeks and 6 weeks, you're just taking it easy. A lot of women, though, are able to return to work, whether it's in the home or out of the home at that point. But in terms of returning to strenuous exercise, lifting without restrictions, it'll be 6 weeks. I tell my couples that other forms of intimacy outside the vagina are okay, but nothing in the vagina while the sutures are healing until after 6 to 8 weeks when the sutures are dissolved. So 2 days, 2 weeks, 2 months. But then after that, you're able to return to your usual activities. The bulge is gone. The bowel movements are better. And the bulge is no longer a bother in terms of intercourse. And so a lot of women do well with this type of surgery. And so again, thankfully, there are good and safe, effective solutions for this condition. Nowadays, women don't have to live or put up with it. And seeing a board-certified urogynecologist is key. So if this video has been helpful, please do like, share, and subscribe to my YouTube channel for future videos so that you'll be notified, and hit that notification bell so that you'll be notified when I release new videos. I'm very passionate about women's health and educating women, so you want to be the first to know when I do release a video each week. And if you are looking for a board-certified, fellowship-trained urogynecologist who will listen, who you can trust, who will diagnose this condition, and if it's a rectocele, get to the bottom of it and fix it because of surgical expertise and experience, I invite you to work with me. And the way to reach me is through my website. That's www.drtugbiyele.com. It'll be in the description or in my bio. And you can click there. It'll take you to my website, which has an inquiry form you can fill out. And that'll go to my team, and they'll help you make an appointment to see me for a consultation. Another way to reach me is directly by calling my office, which is 470-325-1280. And so thankfully, nowadays, women have solutions that can really improve your quality of life, comfort, and confidence. And imagine how you'd feel when you no longer have that bulge in the vagina, no longer have to push that bulge back to have a bowel movement. You don't have to call it bathroom gymnastics, leaning forward, lean backward to the side, sit up, sit down to have a bowel movement. After you've gone, you feel like you feel completely emptied, right? You don't have that discomfort. Intercourse is no longer uncomfortable because of the bulge. All of these things are possible when you have this addressed, when you work with me. And so I invite you to work with me, and I look forward to seeing you in the next video.